those people out in public, sick, coughing, hacking over everything. I'm sure you yourselves have been sick and you've probably gone out in public. There's germs everywhere. Let me show you this picture real quick. You can see the guy coughing, all the little germs going everywhere. This is germs everywhere on it. According to the Center of Disease Control, or the CDC, colds and the flu are spread mostly through direct contact. When a person sneezes or coughs, droplets can travel up to 6 feet or more. Being sick in public harms others, and I want you all to think about the next time you go out in public sick, or the next time you send your children out sick in public. Let's talk statistics on the mortality rate during cold and flu season. There's a 5.8 epidemic threshold right now for the United States. So far this year, since September 19th, we're at 5.3%. Just since September 19th, from back to January 1st, 5.3% for pneumonia and the flu. There have been 146 pediatric deaths between 2014 and 2015 from the flu. 2 years ago, between 2011 and 2012, that number was reduced to 37. Currently, it's more than tripled that rate. So let's discuss some concerns with people that have health problems and what getting the flu or a common cold means to them. According to the CDC, 1 out of every 10 cancer patients who receive chemotherapy will get an infection that will require a hospital visit. I'm going to show you guys some pictures. This is a patient that has leukemia. It says child with leukemia on the bottom. Leukemia. They have chemotherapy, leukemia patients, and chemotherapy kills white blood cells and bad cells. White blood cells are what your body has to help fight off infections and bacteria and other diseases. So when an infection is brought to them, such as the flu, their body tries to fight it off, it typically fails, and they end up being hospitalized, which in turn ends up exposing them to more germs. Cystic fibrosis, which I'm going to show you guys a picture of a patient with cystic fibrosis. See the little child with cystic fibrosis with their nebulizer mask on. This is a nebulizer mask, by the way. 2 parts. This is what they make for kids. Little nebulizer mask looks like a little fish, and this is a little cup, and all the medicine goes up top. And they just put them together. CHKD hands these out to make it more friendly for kids and less scary. So, cystic fibrosis patients, their mucus is thickened throughout their entire body due to the disease. Bacteria gets inhaled through droplets that someone might have coughed. It gets trapped in that thick mucus in their lungs and causes chronic lung infections, which in turn can cause irreversible lung damage and typically ends in hospitalization, which then again can cause them to be exposed to more germs. Let's talk about the elderly and infants. They have weak immune systems. Illness can compile on other medical problems they may already have or they might not know that they have and lead to a hospital visit as well. Here's what you can do to prevent the spread of disease. Wash your hands, wear masks, carry hand sanitizer, and stay home when you're sick. We're going to discuss some ways to avoid going out when you're sick. According to Dr. Frank Esper, a pediatric infectious disease doctor, it's important to remember the flu can cause death, especially in people with underlying illnesses. Do you have a sick child? Get a babysitter, stay home with them, but don't send them to school or daycare. You're going to infect other people's children. Are you sick? Stay home from work. Isolate yourself. Use disinfectant spray, hand sanitizer, wash your hands. You have errands to run like most people do when they get a day off. You remember the errands you have to do. Wait until you're feeling better, or better yet, get someone else to do the errands for you if you can. By going out in public when you're sick or exposing your sick child to others, you could potentially kill someone. Stay home. A life could depend on it. You don't want to be this parent. This is a parent grieving over a loss. If someone would have just kept their sick child home that had the flu, their child that has a chronic illness would not have been exposed to it potentially, and it could have saved them. But because one person's selfish mistake took one innocent life. So next time you decide to go out when you're sick, think about it. Thank you.